Newsday continues here on One News Now. I'm Charles Lejano. The World Health Organization has confirmed that aside from the initial AstraZeneca doses expected to arrive today, another 4.58 million AstraZeneca shots will be arriving in the country by May. To give us more details, we have Greg Gregorio joining us live from Antipolo, where another round of vaccinations is currently ongoing. Greg, good afternoon. How is the vaccination drive going on over there in Antipolo, and how many people are ready for vaccination?
Yes, Ross, we are here at the Antipolo Health Systems Annex 4, where the vaccination program in Antipolo City is ongoing. As of the latest estimate, there have been 48 individuals who have been inoculated with the Sinovac vaccines. Charles?
Right. What is the total number of people that the LGU is targeting to get vaccinated, and what is the vaccine confidence like in Antipolo?
Charles, the LGU targets to vaccinate around 279 healthcare workers today, but according to the local government unit in Antipolo City, the vaccine confidence here is quite high. In fact, the 300 doses that they have received from the national government would fall short as compared to the 500 healthcare workers who have signed up to receive the Sinovac vaccines. According to Antipolo City Public Information Officer and former Mayor Dr. Jun Henares, they have already requested additional doses from the national government, which Secretary Vince Dizon from the National Task Force Against COVID-19 ensured that another batch of delivery of doses will arrive here in Antipolo City. Charles?
Right. Greg, could you tell us which sectors in particular will receive the AstraZeneca vaccines from the COVAX facility first? And of course, health workers will be among the priority. And how many health workers are set to receive AstraZeneca?
Yes, Charles, our healthcare workers will still be the recipient of the 487,000 doses of AstraZeneca vaccine that we are expecting to receive from the COVAX facility today. If we are receiving 487,000, then it would account to around 240,000 healthcare workers, as each individual is expected to receive 2 doses of AstraZeneca vaccines. Charles?
Right. Can medical frontliners aged 60 and above receive AstraZeneca?
Charles, under the emergency use authorization given to AstraZeneca, it can be given to those individuals aging 18 and above, including senior citizens. But according to the Department of Health, they are still awaiting for the recommendation of the National Immunization Technical Advisory Group as to whether or not give AstraZeneca to our healthcare workers who are aging 60 and above. Charles?
All right, let's talk about this South African variant, and in particular, the variation in the efficacy of AstraZeneca vaccines. So far as this particular variant is concerned, what is the WHO and DOH saying about this?
Yes, Charles, according to WHO Representative Dr. Rabindra Abayasinghe, the study which says that the B1351 variant of the SARS-CoV-2 that decreases the 70% efficacy rate of AstraZeneca to as low as 10% is still not peer-reviewed, and its sample is just 2,000 individuals. And up to this point, they still believe that AstraZeneca's vaccine is still effective against SARS-CoV-2, particularly in preventing severe and death because of COVID-19 infection. The Department of Health also said that although they are considering this, or they are looking into this matter, but up to this date, they still highlight that they believe that AstraZeneca's vaccine is still effective for use. Charles?
All right, thanks for that, Greg. That was Greg Gregorio reporting live from Antipolo. The coronavirus vaccine manufactured by India's Bharat Biotech posted 81% efficacy based on interim trial data. This result brightens Covaxin's prospects for sale in other countries. The firm says up to 40 countries have shown interest in the first Indian-made COVID-19 vaccine. The results came out as India struggles to convince its health and frontline workers to take the Bharat Biotech shot. The vaccine was earlier approved in January without late-stage efficacy data. Thousands of frontliners in the metro have already received their first dose of the Sinovac shot. Cabinet Secretary Carlo Nograles says over 8,500 health workers and security personnel have received the Coronavac over the past 3 days. The vaccines were distributed to 32 different sites in the metro. Of the 600,000 doses donated by China, almost 190,000 have been delivered to different sites and hospitals in NCR. Meanwhile, 12,000 Sinovac shots have been delivered to Davao, while around 7,200 doses have been received by Cebu. Nograles also urges Filipinos to follow the steps of health workers who trust in Sinovac.
We acknowledge that we have countrymen who still have reservations about receiving vaccines. But we believe that our kababayan should take their cue from the doctors, nurses, and medical personnel who have received the first doses of the vaccine. To triumph in the war against COVID-19, every Filipino qualified to receive the vaccine should get vaccinated.
Still on vaccines, Cebu is set to roll out its first batch of Sinovac shots today, as the city has received over 7,000 doses of the vaccine earlier this week. Let's get the latest on the vaccination drive with DOH Region 7's Chief Pathologist and Regional Spokesperson on COVID-19, Dr. May Jean Loreche. Good afternoon. She is joining us on the line. Doctora, has the vaccination drive started? And who are the top officials and health workers expected to get vaccinated?
Yes, actually at 1 o'clock or in around a few more minutes, we will start our ceremonial vaccination already here at Vicente Soto Memorial Medical Center.
Doctora, we have received reports that Presidential Spokesperson Harry Roque is in Cebu right now to witness this ceremonial vaccination. Have you spoken to the Secretary, and have we heard any updates from him regarding this vaccination drive?
Actually, we are also going here to meet with him in a while. We are just here on our way to the site, to Vicente Soto, because we have to meet one of our undersecretaries from the Department of Health Central Office, Dr. Yusef Bayugo. And then we will be proceeding immediately to Vicente Soto. And there, I believe the secretary already is present there.
Right. How many people have signed up so far for vaccination? And could you tell us more about the vaccine confidence of health workers there in Cebu?
When you really think about it, the number of healthcare workers from Vicente Soto who will have been vaccinated with Pfizer actually is a lot higher in terms of number compared to Sinovac vaccine. As of yesterday, the numbers that have enlisted is less than 1,000. But we believe that in the coming days with the rollout of the vaccine, that this will change, the number will change, and we look forward to a higher number that will be involved in this vaccination program.
All right, you are set to give out these vaccines already, Doctora. Do you have a specific timeline in mind over the next few days? Like, how long do you intend this process to take?
Again, sir?
How long is your timeline for the vaccination in the next coming days?
5 to 7 days, if starting today.
Right. And do you expect somehow that this vaccination drive will affect the spike of cases there in Cebu? How do you think these two will interact in the next few days?
You know that with only 7,200 doses translated to 3,600 individuals that will be vaccinated, maybe its impact on the rise of the cases may not be seen as yet, especially as it will be the first dose only. Once we have the second dose, and I think there's another batch of around 7,000 doses will be arriving here also for other healthcare workers in the private hospitals level 3, then we look forward to the impact only in terms of our healthcare workers being protected from coronavirus, and then they would be able to attend to our patients should there be more patients that will be admitted. So directly impacting on the cases, no, but indirectly, yes.
Right, then great news for our friends in Cebu. Thank you, Dr. Mary Jean Loreche, DOH Region 7. The League of Provinces of the Philippines has recommended the use of rapid antigen tests over RT-PCR tests for all incoming travelers. Speaking with Cito Beltran on One News's agenda, League President and Marinduque Governor Presbitero Velasco said they are fully supportive of the government's plan to ease up travel restrictions. But Velasco said they requested for the IATF to give them just a little more time to prepare for the implementation of new uniform travel protocols.
The rapid antigen test is not very expensive and you get the results right away. And that, we can also prescribe or impose the PCR test depending on the option of the LGU. So we presented that because, not many provinces have the molecular laboratory ho. And hindi makuha kaagad. Yung waiting time is from 5 to 7 days. And so that will adversely affect yung travel ng ating mga tourists or travelers. Pero what came out is that they only allowed PCR test and it is a requirement prior to travel.
All around the world, vaccines are in and non-essentials are back. More businesses in the leisure space from all around the world are making a comeback as the global vaccine rollout gathers steam. Let's check out this report from Bloomberg's Joe Weisenthal.
Cruises, concerts, live music venues. While the businesses are not still at pre-crisis levels, shares of companies in this space have come absolutely rocketing back in recent months. Check out Royal Caribbean. So it's basically quadrupled off the lows back in March. Bookings already gathered steam. And this is before the virus is even really gone. Or take a look at shares of Live Nation near all-time highs. Remember, this was one of the first stocks to tumble about a year ago when fears of the virus really started to mount. These days, it's on a total tear. People are even ready to flock back to nightclubs. Look at shares of RCI Hospitality, ticker RIC. Unbelievable run, well above pre-crisis highs. So, the global vaccine rollout gathering steam, reopening optimism in full swing, more than 245 million shots globally administered to date. Some countries really making significant gains.
This is only the beginning because we'll see more and more countries as we want to reopen our tourist sector, as we want to have our airlines functioning a bit more normally, is to fill them up with people who have been vaccinated.
Bottom line, the reopening trade is red hot. But if you think back to, say, about 11 months ago, there was all this talk about how bailouts and the Fed credit backstops, they were going to prop up all these zombie companies that weren't going to thrive in the new economy. Well, it turns out there was nothing really broken about any of these business models. They were just massively disrupted by a once-in-a-century pandemic, and it looks like consumers are ready to splurge on what they're offering yet again.
It's confirmed Smart Communications has enlisted none other than Captain America himself, Chris Evans, in their newest campaign. The Hollywood star was recently unveiled as the face of the company's Live Smarter for a Better World 2021 campaign. With this newest partnership, Smart intends to inspire people to commit to sustainable actions with lasting positive impact on society. Evans is the perfect lead for this initiative since aside from being Steve Rogers, he is also leading his own civic engagement show dedicated for the American audience. Let's take a closer look at Smart's latest reveal.
We have the power to create a better world. Simple. Smart ako.
And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.